So this is, I think, the third time I've tried to start. I'm not very confident in making videos, and I feel a bit silly. So I'm just gonna keep talking this time, and hopefully it will go well. So I've been talking with my boyfriend for a little while about possibly making a video blog about all the things that I'm going through, as a way to maybe help other people in the future that are going through something similar, and to kind of just get my thoughts out and have an outlet of chronicling my day-to-day life. So my name's Shelley, and I have lost quite a lot of weight. So I've lost, I think, 85 pounds so far. And I would like to lose another 60. I think it's around 6 stone or 35 kilograms, something like that. If you're not working in pounds, I tend to do that just because I use a lot of Americanized tools, so they work in pounds, and I've just started going along with the status quo. So it's not just another weight loss story. I actually got diagnosed around 5 years ago with a rare disease called autoimmune hepatitis, and I first had symptoms at 16 when I lived in the UK, and I was just a little bit overweight, maybe 10 kilograms or so, but not a particularly significant amount. But because of the way I looked, my doctors misdiagnosed me. And so for 10 years I was told that I had these problems because of my weight, and if I could only control myself, I would be better and I would have nothing wrong with me. And so that led to quite a hard situation of binging as soon as I'd seen a doctor, and then panicking and starving myself the 2 weeks before I would next have to see the doctor. And I've since learned that there's no biological evidence in the test that they had done for what they originally diagnosed me with, and it was purely prejudiced, really. That said, it is a rare disease, so it's hard to diagnose anyway. But yeah, the thing I have trouble with is that the diagnosis they made, which was non-alcoholic steatohepatitis, which basically means there's fat in your liver and is impairing its working. And there was never any evidence to diagnose me with that. So fast forward 10 years, I was extremely sick. I vomited blood. It was like The Exorcist. And I went into hospital. I was at my heaviest weight. And for the first time in my life, the doctors took me seriously. So when I was 26 years old, I was diagnosed with a rare disease called autoimmune hepatitis. And essentially it's my body has decided that my liver is not mine and is rejecting it as if it was somebody else's transplanted organs. So there is medication for it, but unfortunately, because I was picked up so late, I don't respond to that treatment. And so over the last 5 years, I've got progressively worse. And this week I was listed for transplantation. So I do have some proof, just in case anybody thinks that I'm making things up. So it's in German because I'm in Switzerland, but this is a study that I've been asked to be part of by the hospital that will do the transplantation. So I got listed on Tuesday, this week. It's been 5 months of tests after almost losing my life in May. So I again had a massive internal bleed, much like when I was diagnosed, but this time it didn't stop and they had to do an emergency intervention. So I went into surgery, I was in intensive care, and they did a procedure called TIPS, which is where they put a small metal tube into your liver and they divert the blood around it, so your liver doesn't have to deal with the blood flow and you have less risk of bleeding. Again, I think I'm rambling. I still don't know really how to structure videos and how to edit, so I apologise, and hopefully it's not too bad. So I sort of have 3 things that I need to talk about in this blog. So one is the continuum weight loss. I don't know if people know, but transplantation of the liver is one of the organs where you could have a deceased donor or a live donor. So this is also the case with kidneys. Obviously, the kind of organs that you can only have a deceased donor are lungs and heart, because you can't live without your lungs and heart. So they can't take half a heart from someone, but in the case of the liver, they can take half a liver from someone that's healthy, and then they put that half of the liver into me, so both of us have half a liver. And actually, with some donors who pass away and pass on their organs, their liver might be split between 2 people and they could save two lives with one liver, which is amazing. So in the donor, it grows back within, I think it was 3 to 6 months, I can't remember. And for the recipient, it's a little bit longer. However, to receive a live donation, because they can only take the partial liver, you have to be below a certain weight. So there's something called small size syndrome. So if you have a partial liver, and the ratio of size of the liver versus the recipient's weight isn't correct. So if the liver is too small, it can't support the size of the body, and it will fail. So they know this after many years, and so at the moment I'm too heavy for this to be an option. So I'm also quite healthy, as you can see. Like, I'm not healthy in the sense of a normal person, but in terms of transplant patients, I'm right at the bottom of the list. So I have some time to lose the extra weight. I'll kind of be going through, hopefully, getting myself back motivated, because I've had a little bit of a stall, quite a big stall. I've been stalled for about a year. And now I really need to start focusing on the weight loss, getting myself as healthy as possible for transplantation. So all my other organs, my metabolism, everything else, obviously not my liver, I can't control that. So that's one thing. And then I will also be kind of talking about the transplantation process, what I'm going through. So I think my next video I'll do what's happened so far. Hopefully it'll be less rambly than this one. It's already 9 minutes, so I think I better start wrapping up. And then maybe some things around my other parts of life. So different situations I've been in previously. I've had some close family losses that have really impacted my life. And I've also been, when I was much heavier, I was also in an abusive relationship, and thankfully that's long over, and I've rebuilt my self-esteem and come out the other side. But that was an entire process and a particular chapter of my life that I may touch upon. I don't know if I actually introduced myself, actually. I probably did, I can't remember. But yeah, my name's Shelley, and I'm 31 years old. I keep thinking I'm still in my 20s. I'm actually in my 30s. And I have a job, I have a flat. I have a boyfriend. It's not my flat, I rent it. And I'm living in Switzerland, so I moved 6 years ago, a year before I was diagnosed. So yeah, I think that is probably enough for the first video. I don't have editing software at the moment, like I mentioned. Hopefully the quality will improve. Stick with me. Have a nice day to everybody. Bye.